I mean, who would have noticed another madman around here?
Things are possible. They're particularly possible when crises hit. Monnet created the whole EU pretty much on the basis of what you call beneficial crises. And because of the nature of the world and where things are going, I think we're going to be seeing lots of beneficial crises shortly, which will enable us to change things.
You must level with the British public. More families, many more families, are going to lose loved ones before their time.
Not even our generals are mad enough to shell their own men.
Has revised the risk to the UK population from very low to low. And has concluded that while there is an increased likelihood that cases may arise in this country, we are well prepared and well equipped to deal with them.
Well, I'm afraid it'll have to wait. Whatever it was, I'm sure it was better than my plan to get out of this by pretending to be mad.
Head of the NHS since 2013, do you regret the bed reductions and the failure to increase nurse training numbers during your tenure, which have left the NHS in a position where it entered this crisis with its critical care bed base amongst the worst in Europe, with Italy, for example, having twice as many ICU beds, and the UK having the lowest number of nurses and doctors per head amongst developed nations, according to the OECD? Isn't the lesson from this crisis that the NHS needs more capacity at all times if it's going to be ready to deal with this kind of surge in demand, and it can't be made to operate with no slack as it has been under your watch?
Perhaps you could sort of take it on the chin, take it all in one go, and allow the disease, as it were, to move through the population.
I have a plan, sir. Really, Bulrick? A cunning and subtle one? Yes, sir. As cunning as a fox who's just been appointed Professor of Cunning at Oxford University. Yes, sir.
We'll see what the scientists advise. It's the best thing I find. These guys are brilliant. They're epidemiologists who understand behavioural psychology.
Well, I'm afraid it'll have to wait. Whatever it was, I'm sure it was better than my plan to get out of this by pretending to be mad.
Which is why no health service in the world, anywhere in Europe, anywhere internationally, would be able to withstand a coronavirus epidemic. Unless the sort of measures that the public are also involved with are also put into place.
I'm Afshin Rattansi, and you're watching the season finale of Going Underground before our return after Easter, coming up in this special edition. The fallout of the dirty war on the NHS, with disease striking at the heart of government, and as UK Health Service staff die from coronavirus without protective equipment or adequate testing. Going Underground speaks to legendary journalist and filmmaker John Pilger about neoliberal destruction in a time of neoliberal plague. Your work casts doubt on NATO nation governments and other governments. Can we trust our governments in what they say to us about coronavirus?
No, we can't. Absolutely not. That this virus has managed to spread through modern developed societies, especially Britain, is a crime. Do you know, in 2016, a drill called Exercise Cygnus, and that was a drill to practice for a pandemic, happened in London, and the whole drill was laid out. The result of that was that the health service was overwhelmed. There weren't enough beds. There weren't enough ICU beds. There weren't enough ventilators. There there weren't enough clinicians in the right place. The whole system, which had been, the health service, which had been battered by cuts and privatization for years, failed. And the chief medical officer then in 2016 asked the government to heed the warning of what they'd demonstrated very clearly. And yet the Department of Health in London suppressed the documents which had the conclusions of this drill. They kept them from going public. Now that is only 4 years ago. So they knew the whole preparedness for this should have been in place. But of course they knew they couldn't put it in place because the government had devastated the National Health Service since the 2012 Health and Social Care Act.
Get out of this by pretending to be mad.
Moving forward with our plan.
Good luck, everyone.
More families, many more families, are going to lose loved ones before their time. Perhaps you could sort of take it on the chin. And allow the disease, as it were, to move through the population. More families, many more families, are going to lose loved ones before their time.